I remember talking to my sister on the phone before I opened the email that had those results, and I was just crying.
Uncertainty is everywhere in medicine.
Like, what if I'm not allergic to my implant? Like, what is happening to me?
But we don't always know what to do with it.
I will never forget one orthopedist who, when I didn't improve on the basis of his diagnosis and treatment, said to me, "You know, patients like you are really unsatisfying for doctors."
Join award-winning medical storytelling podcast, The Nocturnists, as we dig into the gray zone. Stories of ambiguity, uncertainty, and medical mystery from clinicians and patients.
We talk about in medicine, we use a shared decision-making model. We're sharing all the information and come to a decision together. It's not really how it works.
When people come in with kind of vague symptomatology and gaps in the history, I would just go straight Joe and say, now tell me what's really wrong with you. And out it would come.
First episode drops this spring. See you there.
Welcome to rePROs Fight Back, a podcast on all things related to sexual and reproductive health rights and justice. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I feel like I am finally starting to get from under the mountain of email from when I was gone. I feel like there's so much that happened and I'm still just trying to catch up. But I think things are like finally moving a little bit and I'm feeling like I can see the bottom of my inbox, which is exciting. And it's getting to be in a much better place. So that's good. And I have been busy trying to edit all of my pictures from vacation, which has also been a lot of fun. But I took so many pictures. It is wild. I definitely got carried away. I had a new camera, so I was like definitely playing around with it. And there were so many. And then when I uploaded them, for some reason, I don't know what happened, they like uploaded in utter chaos. So as I was like clicking through them to edit them, it was like just in no order whatsoever. Luckily, when I finished and got them like all in a folder, they were named correctly. So I was able to sort them by name and now they're back in order. But man, I was really worried as I was editing that it was just going to be chaos and I was never going to figure out like which photos were from which day and which location and things like that. But now that I have them separated and in a folder, I can do that better. So that was a big relief for me just because the chaos was kind of making my mind a little crazy. My two little monsters are getting a little bit better about not being quite as clingy. Like, as I am recording this, Luna is actually sleeping on my bed in a different room instead of right by me, which is nice. On the other hand, Cinder is, like, parked right next to me on my desk. Although she's, like, lives on my desk when I work anyway, so that's not really a huge change. But they are both still very attached and like to the point of if like I go in my bathroom and close the door, like somebody is sitting out there crying. So they are still dealing with me being gone for 2.5 weeks, but they're getting better and being good. So that's something that is something right now. Other than that, I feel like there's just been a lot going on and I'm just still trying to find my footing a little bit after being back. So maybe we'll just leave it there and turn to this week's episode. And I'm very excited for this week's episode. We're having our brand new rePROs senior fellow, Preston Mitchum, on to talk about a range of issues. I'm so excited to have him on. It has been quite a while since he's been on the podcast. So it was great to have him, and I'm so excited to have him as part of the rePROs team as a senior fellow. So, keep your eyes open for some writing by him that we'll have coming soon. And I also something for this episode, we're going to put a trigger warning on it just so that you are aware. We do talk about suicide. We're talking about the 988 suicide prevention hotline. So we don't talk details about suicide, but suicide is a a large part of the last third of our conversation. So if you need to step away, please step away. If you need to come back to it at a later time, we'll see you then. Or if you just can't listen to it, we'll see you next week in a different episode. But that is the last third of our conversation. So if you want to listen to the first part where we were talking about some of the LGBTQ cases that were in front of the Supreme Court this past couple of weeks. So it was one about having inclusive books at school that's being challenged, and a case that is challenging, at the core of it, challenging the preventative services group that decides what preventative services are covered under the ACA. And the part that the group that is suing is challenging was having to cover PrEP. So we talk about that. So it's a really great conversation. Of course, it's a great conversation. It's Preston. But yeah, the last third, we do talk about suicide. So just a little bit of a trigger warning. Okay. With that, let's go to my interview with Preston. Hi, Preston. Thank you so much for being here today.
Hi, Jenny. Thank you. I'm so excited to be back after what feels like forever, but I'm really happy to be here.
I was thinking back, and I think the last time you were on was maybe the episode we did right after you had COVID, and we talked about COVID and your personal experience.
Yes, that was. Oh my gosh, that was one of the last times.
That'd be 5 years ago.
Thank goodness at that time. Well, it hasn't really come and gone. It's still here, whether we discuss it or not. But in my body, it is gone, thankfully.
Yeah. That is shocking to think it has been so long.
Yes.
But you've been up to so much and have been doing so many wonderful things. I'm so excited to have you on. But before we jump into all the conversation, which I sometimes do when I get excited, would you like to introduce yourself before we get going?
Yes, happy to. Hey, y'all. Preston Mitchum. I use he, him pronouns. I am based in Washington, D.C. I am a Black queer writer, policy analyst, reality TV star, some would say, and all things nerd and Beyonce. So I'm so excited to be back here.
I have to say, I did not watch Summer House because I couldn't do it. I was like, he is my friend. I cannot watch any sort of mess. I just can't. But I enjoyed clips I saw and the amazing gifs that you have of you.
Yes. I would joke and tell people, I'm I promise you will like me in real life and on the show.
It's just it's hard to watch a friend in that.
No, I get it.
But I was so excited for you.
Thank you.
Okay. So there was so much happening in the news in the last couple weeks that the only person I could think of to have on was you, because it relates to so much of your work and broader LGBTQ issues that you were the ideal person to talk to. So let's start with the Kennedy versus Braidwood case that was in front of the Supreme Court. Do you want to tell us a little bit about what this case is about?
Sure. So most recently, the Supreme Court heard our arguments in Kennedy versus Braidwood Management. In this case in particular, so we have Braidwood Management, who is a Christian-owned business, and then 6 individuals in Texas. And what they've done is they challenged, the Affordable Care Act again. Right? Because there's been so much litigation and relitigation of the Affordable Care Act. But specifically, what they actually challenge are the requirement to cover preventative services. So for those who don't know, there's a structure called the U.S. Preventative Services Task Force. And they're an independent entity that actually is convened by the federal government, and they make recommendations for preventative services such as PrEP, pre-exposure prophylaxis. We can get to that in a minute, but nearly all private insurances must cover without cost sharing. And so that is specifically what's at question, is whether the independent entity that's convened by the federal government violates the U.S. Constitution's appointments clause. And that's the case because, according to the Constitution, offices of the United States may only be appointed by the president, subject to advice and consent by the Senate. And the litigants here, Braidwood Management that is, are claiming that the USPSTF, the Preventative Services Task Force, does not have an appointment or advice or consent by the Senate and therefore violates that clause. Why that's a deeper issue here, again, is because they are the structure that discusses things around preventative services. And so one of the things that ultimately will be questioned then is if, therefore, PrEP And the low-cost coverage given by the ACA, therefore, violates the Braidwood Management under what they're alleging to be a violation of their freedom of religion, meaning that they don't believe that there are certain things that they actually have to cover or certain things that people have to cover, even though they are, and sometimes especially because they are preventative services.
And this may all be familiar to our guests, our audience, because this has come up before in a little bit of a different way with the birth control benefit. This is the same place where we had the birth control benefit come up, and when it was challenged for similar, like, companies saying that they didn't have to cover birth control for religious reasons, they went after it that way, but this is going a little further and going after the structure of the Preventative Services Task Force.
Correct. And I think another point that your audience may be interested in is that, we know President Trump has supported ACA repeal many times, but especially during his first term in office. But his administration is actually defending the lawsuit. But I want to be clear, that's nothing to be proud of. The only reason why his team is defending the lawsuit is because he is currently the president, right? And so, it's going to allow him to actually have broader appeal and really broader latitude to some of the recommendations that ultimately some of his entities that are independent, but again, run through the federal government can actually push through at this point. So I know someone, I talked to someone recently, they're like, that's a good thing, right? And I'm like, I know we're looking for wins, but I assure you it is not a good thing.
Yeah, like it is like a bit messy, right? Because we want to make sure that the Preventative Task Force is able to do their job and have that be supported and not have to go through the Senate and all these extra hoops to get people in place, because sometimes that makes it hard to get good people.
Exactly.
But also, if you have this very anti-science and anti-LGBTQ and anti-rights administration, that also is mess.
Exactly. Especially when you layer on so-called religious freedom on top of that. And so, ultimately what we're talking about here is not only the U.S. Preventative Services Task Force, but things like the Religious Freedom Restoration Act, which, again, here they're alleging is being violated because they don't believe that medication to prevent HIV from sex or injection drug use is something that actually aligns with their religion, if you will.
So I guess that leads me to think, what would this mean? What are the implications of a bad decision in this case?
There are tons of implications in this case. I mean, I've been a PrEP user for about 10 years now. So yeah, I think I actually started PrEP in 2015. And one, PrEP is before you had pharmaceutical companies like Gilead offering codes for people who cannot afford PrEP to actually get PrEP to lower the cost to $0. Then again, of course, because of the ACA's low cost or no cost coverage for PrEP, you have people who ordinarily would have been paying $2,000 a month for a 30 or 60 or 90-day supply to now where the numbers are $0 for many people. And sometimes, I talked to some friends who may be paying $10 and $15. So still an incredibly low cost coverage for PrEP. If, these numbers could skyrocket, quite frankly. And we don't really know exactly what that looks like yet, but that's one of the implications of what happens if the conservative justices sway a little too conservatively. In this instance, we could be looking at PrEP becoming extremely unavailable for people for no other reason because of the cost, obviously making it incredibly unavailable because it's so exorbitantly priced. I will never forget actually before seeing the sticker shock of $2,100 ring up at CVS Pharmacy when I initially got on PrEP. And I'm like, there's no way I can afford to pay this. And it was a pharmacist who actually told me about ways to actually reduce it to $0 or low cost coverage. And so that's a huge implication there. Frankly, I think about specific things like what happens when you don't have access to PrEP. I mean, PrEP in terms of preventing HIV from sex is about 99% effective. For injection drug use, it's about 75%, but still that's an incredibly high rate of effectiveness, particularly when you're discussing things like most at-risk populations or marginalized communities. So like men who have sex with men, sex workers, trans women, people in confinement settings, things like PrEP and having access to PrEP is a life-saving intervention for them. And especially when you couple it with the fact of like HIV prevalence and incidence rates. I think a damning thing here, quite frankly, is many of these people, be it the far-right extreme or Christian nationalist movement. I mean, some of the stereotypes that are happening here is, one, they believe that the only people who are even using PrEP are gay and queer people or people who are promiscuous, if you will. But when it's really people who actually are just protecting themselves, right? Straight women also could be diagnosed with HIV. People who have sex for the first time could acquire HIV, right? Like, this is not something that is just for one group of people. And that is really the stereotypes around a lot of this, quite frankly. Two, I think a lot of what we're seeing here are people who believe that if you don't make PrEP available, then people probably will stop having sex. When, again, we know that that's not true, in the same way that many of them thought that if abortion access would not be made available, the rate of abortions would decrease. Again, we're seeing the opposite. And so, I think ultimately there are many implications happening here, and all of them, quite frankly, are rooted in fallacies and things that are just, quite frankly, illogical.
Yeah, it just makes me think of the people who are like, if we don't teach kids sex ed, they won't have sex.
Exactly. It's like, no, they're actually having sex, and they're doing it in more sexually riskier ways because we're not giving them the tools and the resources to actually make informed decisions for their bodies and their partners' bodies.
Yeah. The other thing I was thinking of as you were telling your story is that you got lucky, right? You went to a pharmacist who was willing to give you that information that enabled you to access PrEP you could afford. If you went to like an unsupportive pharmacist, they may have never told you, and you wouldn't have been able to access the care. And like, I know you would have probably navigated the system and figured it out, but there are a lot of people like that would have been the end.
Well, and that's important to mention, right? Because I am someone who, at this point in my life, I mean, even back then, I had 3 degrees. I was doing work in research and policy on issues related to health equity work, right? And there were still things I didn't even know to ask the questions about or how to navigate the systems. Now, being as diligent as I am, again, to your point, I would have figured it out ultimately. But there are many people who don't have access to those resources, and quite frankly, who don't have access to affirming people like that pharmacist who said, wait, especially as she noticed I was about to walk away. Right. And so, like, when you don't have people in your life who can navigate those systems in that way for you, or, don't have anyone who's affirming to you and your identities, they will let you walk away. And then you're still going to continue to engage sexually, because many of us do, in the ways that still feels best for you. And I think the problem with a lot of this is there's still a one-size-fits-all model in healthcare writ large, right? Most of it is not individualized care. Most of it is not culturally, clinically competent in order for people to actually have a safe and learning environment, even through things like medicine and medical interventions. And that is what we're going to see a lot here, I really fear, because even the conversations of why people take PrEP is still a fascinating one to me, because for me, a lot of people can ask the question in love, why do you take PrEP, as an example? But the reality is we know why most people take PrEP, right? We know what PrEP is for. So I really want people to lean more into love of asking questions and genuine curiosity, as opposed to what sometimes feels like a gotcha moment, or a moment of saying like, well, you could just reduce your sexual partners. Because the reality is that's a one-size-fits-all model approach that's unhelpful in any clinical setting. They're going to engage in the ways that feel best to them. The question should then be, how do we actually make sure we're building up interventions that honors those people's lived experiences, as opposed to sometimes just what the books say.
Yeah, and it like pushes people away from accessing that care if they feel like they're being stigmatized or not listened to or heard or
shamed.
Yeah.
I mean, and there's tons of data on it, right? Like we should not be having to tell these stories again. I mean, there's been data on this for decades, and I wish that was hyperbole, but there has been data on for decades about how judge, shame, and stigma actually really feeds, unfortunately, this really bad healthcare infrastructure and people's experiences within it.
Okay. So unfortunately, this wasn't the only time things related to LGBTQ issues were at the court last week. Well, I guess when people hear this 2 weeks ago. And I know we're not going to spend a ton of time on this, but it just hits like a special niche issue for me because I'm a big book person. I love and I make sure to read banned books. So this like hit me right in my sweet spot. And that is the Mahmoud versus Taylor case. Do you just want to do like a really quick, like what it was about? Because it was dealing with books related to LGBTQ. I mean, I don't even want to say issues. Like it was just like representation.
Yeah, I mean, I ultimately think this is going to always have a sweet spot for me in particular, if for no other reason, because my very best friend, George Johnson, who wrote All Boys Aren't Blue, had the number one most banned book in 2024. Like bigger than literally every other book. It was number one on the list. And we joke about it sometimes and say, we're number one, right? Like good old America. But there's actually a really sad situation when you really have people actually discussing and litigating against what can be heard or taught or what your children can read. Like it's really sad.
And it's such a beautiful book. So y'all, if you haven't read it, please read it.
Mm-hmm. I mean, it's really sad, I think, also because the case, Mahmoud v. Taylor, speaks from home in several ways, right? It's really a group of parents that's brought in Montgomery County, Maryland, which is in D.C., it's our backyard.
Yep.
And it's against the Board of Education of the school district specifically. But, the reality is it revolves around the district's decision to include certain books with LGBTQ plus characters and themes in the school curriculum. And specifically, the parents here are arguing, right, that the religious rights are being violated. I mean, that's the thing. That's the through line with all this, right?
Yeah.
Religious rights, religious freedoms. But those parents here are arguing that their rights are being violated by not being able to opt their children out of class when such books are to be used. And listen, for a lot of people, that sounds logical. It sounds reasonable. Most people will affirm the parents' decisions, that they're actively attempting to parent what they believe is best for the child. But I think the problem is, who they're not asking? The children, right? They're not asking the young people if they actually want to learn and be included in those conversations and learn more about like characters that are beyond their own, or maybe characters that they actually are in real life, but that these parents are refusing to actually accept. And to me, that is going to always be the most fundamentally frustrating part and scary part, are that many of these books written by these authors are written with love and care. We think that there's an environment, and we know that there's an environment where children and their parents need to see families like their own in books, right? Like I think about my first time even reading or thinking about queer characters, or the first time I've seen people in film and television, and what does that actually mean to have your stories told? And how do you feel seen? And I think especially in light of what we're seeing regarding the erosion of DEI and justice from the Trump-Vance administration. I mean, this is unfortunately a perfect time for people who actually want to tout religious freedom while still being hateful to people right now, because they have the background of the federal government to affirm that thinking and affirm that decision. And so this is nothing more but just censorship, right? It's censorship. It is segregation of books. It is creating an environment where we believe queer people don't exist. It's creating an environment where we don't believe that all families deserve to be seen. And that is going to be the danger of this specific case. So yes, in short, all of it is because the district and the Board of Education for the county decided to include LGBTQ books. I mean, what a shock and horror, I guess.
I know, right? The bottom line, they wanted kids to be able to see themselves and their families in the things they were reading.
Correct. And not to the exclusion of other people, right? Like, I think that is always what I'm going to find the most fascinating in these situations, right? So even thinking back to like comprehensive sexuality education, you would hear people then say, we need to teach about abstinence. And I'm like, well, abstinence is inclusive of comprehensive sexuality education. And so I'm like, the problem, what you want to hear is abstinence only, when we know that that is actually not rooted in science or any data that we have. Similarly, it's not as if we had the school district that stated, we're going to have LGBTQ books with LGBTQ characters, and that's it. We don't care about straight people. We don't care about men and women households. We don't care about, the white picket fence and the 2.5 kids. But they believe, many of these people believe that the inclusion of LGBTQ plus people is to the exclusion of straight people. And that is just fundamentally untrue.
Yeah. The point about sex ed is well taken. Again, as you know, someone who had sex ed from a nun, I really feel the lack of fully comprehensive, inclusive sex education and the impact it has on your life.
Yes, we all need really good sex ed. And it's amazing when you talk to people about their sex ed and if they believe they have good sex ed, many people think that they do. And I'm like, no, you saw a condom being put on a banana.
I did
That's
not.
Right? Well, me either, to be clear. I did not either. But I really want us to expand what we believe good sex ed to have meant for us growing up. Because if we actually reflect on it, most of our sex ed was like, don't get pregnant, don't get STIs.
That's it.
That's it.
Yep. And the perfect time to have this conversation, because when people are hearing this episode, it will be Sex Ed Month. So, okay. So the other thing I wanted to talk to you about is something that I thought of you the second I saw it, because I knew this was your baby. And that is the administration talking about getting rid of the 988 system. First, before we get into cutting it, let's talk about what it is and honestly, the amazing work you did to make it happen.
Thanks, friend. So yes, 988 is still the 3-digit number to reach the National Suicide and Crisis Lifeline. Back some years ago, it was a long form number. And so a lot of people got together in the mental health, crisis prevention, and suicide prevention space and said, you know what, we need a short number for people who are going through crisis or suicidal thoughts or ideations to really just remember something. And it could be via text, chat, or calling. And at this time, I served as the Director of Advocacy and Government Affairs at the Trevor Project. And my job was to really help build up 988. And so at that time, we had got the legislation passed. It was the first legislative text with the word LGBTQ plus in it that passed unanimously out of committee. It passed Congress, so it passed both House and Senate. And it was signed, believe it or not, actually by President Trump, Trump 1.0. And so that's why all of this is really fascinating, maybe not surprising, but fascinating now, because I think a lot of people actually don't realize that the initial text was signed into law by President Trump.
Nope, totally forgot.
Yeah, and so it was one of the biggest bipartisan wins of probably the past 10 years, I would argue. And so, so while anyone in a mental health crisis can text or call 988 and be connected to a trained counselor, the line has specially trained counselors specifically for high-risk groups like veterans and LGBTQ plus youth. I am proud to say during my work at the Trevor Project, myself and others advocated for nearly about $29.6 million in LGBTQ plus specialized services. So you call the number, you talk to a crisis counselor who may be queer, trans, or non-binary, or at the very least are skilled and culturally competent in the lives of LGBTQ plus youth. We are just last year alone, approximately 40% of LGBTQ plus youth considered suicide. And that was by a recent report from the Trevor Project. And most recently, because of a leaked budget, which is probably the scarier part, we're learning that HHS, which is obviously now spearheaded by someone who does not care about data, Mr. Robert F. Kennedy Jr. himself, we saw a leaked budget that stated that there were likely going to be some significant cuts and almost the elimination of services for LGBTQ youth through 988 ultimately.
It seems so cliche now just to be like, it's so cruel. And just thinking about all of the things that are happening in this moment, attacking trans access to healthcare, trans kids' ability to play sports, and all of these things that are pushing people to need those services even more right now, and then to take away those services is just absolutely devastating.
Yeah, I don't know if I even have a better word for it than evil. I mean, when we already have, again, this leaked federal budget that specifically looked at the elimination of services for LGBTQ youth. We already know the higher rates of suicidal ideations and attempts and sometimes completed suicide is LGBTQ youth and young people generally, quite frankly. We also see the numbers increase for older people. And, and again, we can just go through the marginalized communities gamut of who has experienced suicidal thoughts, why that happens, why we need upstream suicide prevention services, because suicide is not just about someone being sad, right? Sometimes it can be because of serious mental illnesses. Other times it could be about what we know to be the social determinants of health. I mean, right, there are people who experience suicidal thoughts because they're housing insecure, because they don't have access to healthcare settings, because they don't have gender affirming care, because they don't have jobs, or because they're underemployed, right? So it's not just the things that I think some of us just think about in terms of suicidal thoughts and suicidal ideations. And so when someone says and they acknowledge and honor that they are going through something and they're like, I actually need support, I'm going to call someone. And for the response to that be, actually, we're going to take away your literal lifeline. We're going to take away the fact that you've acknowledged that you can be harmed, including self-harm. We're acknowledging that you may feel depressed or lonely or have anxiety. And even though you're looking for someone to call, we're not even going to fund that. Like, that is an evil thing to do. And there are times I just always want to call things what they are, because it's not just sad, right? It's actually like something that is ultimately fundamentally evil and will increase, and this is not hyperbolic, will increase the death of people. And honestly, I think that's what they want at this point.
Oh, that's just all so heavy and yeah. But I also think it's really important to remind people, you did when you started, but like, let's bring it back at the end to be like, it has not happened yet. The services are still available. You can still access 988 if you need it and get LGBTQ specific services.
Yes, I had to make sure I had to even say is, because I was already affirming that, right? So yeah, 988 is still available. You definitely can still call, text, or chat if you need anyone to talk to, if you're going through anything. And that means having even a bad day, right? The one thing that I always messaged around 988 was that the moment you should call is not the moment when you are finally in a state of crisis. It can be just, I've had a bad day, I broke up with someone broke up with me. Like, any moment that can build up to the state of crisis or paralysis should be the moments where you start to call. And these are trained counselors, right? They're not just people who, want to pick up the phone and talk. That's great, and they will, but they are also trained and skilled in actually talking to you about your experiences, your moments, asking you questions, sometimes sitting in silence, hearing you crying with you, right? Like, these are people who really are affirmed and believe in you and want to make sure that you all still see the next day, to not just survive, but to thrive ultimately. So please feel free to call, text, chat 988. There are additional lifeline numbers, of course, that people can call too, but 988 is always going to be a through line and the best way to start.
Okay. So I know this is something that is right up your alley. I always love to end episodes not just focusing on the issues, but like, what can people do? How can people get involved in this moment? So what are some things you would recommend that people who care about these issues, like, what can they do to take action right now?
Yeah, these are, I think, for a lot of people, I'm going to say this, and this is what I've been advising a lot of clients on, and prospective clients through my consulting firm, PDM Consulting. I think a lot of things is about honoring your risk tolerance. For many people and organizations, they are incredibly risk averse for a variety of reasons. And sometimes I think it's okay to have a higher risk tolerance. In other instances, it's okay to have a lower risk tolerance, particularly if you are of a marginalized community that usually will be the first to be attacked, whether it's on the front lines, quite literally, on the ground or if it's virtually. And so I think, one, it's always about assessing your risk tolerance and what you have the capacity to do, and also sometimes challenging yourself to do a little bit more. So, if you're one of those people who have, additional funds, make sure that you're actually, donating those funds and actually purchasing things like the banned books. Like, there's a banned book list. Go on the banned book list. Make sure that those books are available to people. Make sure you're providing that within libraries or school systems to the extent that they can still have them, or your family or your friends. That's really important. Because, fun fact, a lot of these books that end up on the banned book list ends up being on New York Times bestsellers list because people know that there's a reason why they're attempting to ban these books.
If you ban it, you know it's good.
Exactly. I think another thing is for folks who really want to be more politically engaged, please, and if you're listening to this podcast, I know in many ways you have to be, but please make sure you're paying attention to what's happening, of course, at the federal level, but especially at the local and state levels. I really do think we miss local and state actions because we're paying so much focus on the federal, and we should. And the local and state levels are where it's at, right? It's where you talk about highways and byways, school systems. I mean, things that actually impact your day-to-day dollars and cents. A lot of that is because of local and state. For funders, I've had some very challenging conversations with funders recently. And part of it is because, and I say this in love, but also in challenge and encouragement, a lot of funders are not meeting the needs right now. Many of them I've talked to are still doing things like very restricted funds. They're not attempting to increase specific funds. And that is really problematic for a lot of these organizations that are trying to navigate a very hostile political climate. And so in these times, we need to be able to trust these organizations to do a little bit more with the money that they're given and not say that it has to be specific to this line item, because we're not giving them a chance to actually expand and meet the needs of their community and members the best way that they know how. So that's really a challenge for funders as well. So again, donations, funders do better. There's ways to still, be connected to like the advocacy and the policy side as well. But just most of all, please, I hope that people don't feel like they need to either be silent or cower or move to the middle. Right now, we need people need to be seen, sure, always. Part of being seen, though, is making sure that we know we're staying true to our values and our mission. And so if that means we need to shift terms to honor what feels safe, do that, but don't shift your values. And so we need to really push for like how to shift terms and not values. Unfortunately, I've seen a lot of organizations shift both. And trust me when I say we're going to lose in the long term, even if it feels like we're having short-term gains or advancements.
Ooh, I feel that last part, especially like worrying about what groups are going to do to ensure they can continue to get funding, if they get government funding, with all of these attacks on DEI or certain parts of our sector that we work in. And that has been something that has definitely been worrying me.
Yeah. I mean, I'm sure it's happened in spaces I may just not be privy to. What I'm really hoping is that we have a lot of principals and CEOs who are trying to really pull together many funders sectorally, I imagine, just to kind of discuss what their approach has been and what it looks like, because it hasn't been that great. And I think all of us know that, even if none of us are in a safe enough position to say it.
Preston, as always, it is such a joy to talk to you. I'm so happy to have you on after too long of an absence.
Yes, I'm happy to be here too.
So thank you for being here. And I'm sure we'll have you on again soon to talk about something new.
Thank you. For any of your listeners, you can always look me up at www.prestonmitchum.com or Preston Mitchum on all of your platforms. So thank you so much, Jenny.
Yeah, and we'll absolutely have links to all of the things in the show notes so you can easily find Preston wherever he is. Okay, y'all, I hope you enjoyed my conversation with Preston. Like I said, I am so excited to have him on the podcast and so happy that he is now a senior fellow with rePROs. I am looking forward to what he is planning to be writing for us. I'm just very excited to have him on board, and I hope you enjoy our conversation, and we'll make sure to check out his writing once we have some of his pieces up. And with that, I will see everybody next week. If you have any questions, comments, or topics you would like us to cover, always feel free to shoot me an email. You can reach me at Jennie, Jennie, at reprosfightback.com, or you can find us on social media. We're at rePROs Fight Back on Facebook and Twitter, or rePROs FB on Instagram. If you love our podcast and want to make sure more people find it, take the time to rate and review us on your favorite podcast platform. Or if you want to make sure to support the podcast, you can also donate on our website at reprosfightback.com. Thanks all.